In this video, I'm going to explore the different types of tendonitis that can affect the wrist. I'm going to look at which are the most common tendons that can be affected, what the causes are, and how you can get it better. I'm Stephen Bunting. I'm a specialist MSK physiotherapist working in the UK. Welcome to the channel, where I explore the common MSK problems that affect everyday people and the evidence-based treatments that can help. Well, tendons are the rope-like structures that most muscles use to connect to bones. Itis means inflammation, so basically tendonitis means an inflamed tendon. Now some tendons, like for example the Achilles tendon, the hamstring tendons, the biceps or triceps tendons, are single tendons which act alone or as part of a small group in order to move a particular joint. But the tendons around the wrist and also the ankle and foot are a bit different. There are lots of them bunched together. In the wrist there are 12 tendons which cross over the back of the wrist and another 11 over the front of the wrist, and between them they move the wrist in all different directions and also each individual finger and thumb. And in order to stop them all rubbing against each other and the underlying wrist bones, they each have a tendon sheath which surrounds them, a bit like the insulating layer around an electrical cable. And within each tendon sheath is a layer of synovial fluid, which is an oily, slippy fluid which bathes the tendon fibres and allows them to move freely within the sheath. In this way, lots of tightly packed tendons can move freely in a confined space without friction. At least that's what's supposed to happen when things are working normally. But like any system, it's only as good as the person using it. If you overload the wrist tendons, then they can become inflamed. And the inflammation in tendons with sheaths gets contained within the tendon sheaths, causing a tenosynovitis, which is an inflammation of the tendon sheath. So to be accurate, we don't get tendinitises around the wrist. We get a tenosynovitis because it's the wrist tendon sheaths that get inflamed, not the tendons themselves. In the vast majority of cases, a wrist tenosynovitis is caused by overuse. It can be a single instance of heavy lifting, but more commonly it's caused by lower level repetitive activities over a longer period, usually a few weeks or months. The usual activity culprits are excessive use of a keyboard, mouse, tablet or gaming controller. Also things like writing, needle crafts, racket and throwing sports, and also using weights in the gym with poor wrist form. And anyone can get it, and at any age. It is more common in the younger age group up to middle age, because these age groups are more likely to be involved with repetitive strenuous activities. The other group of people who are at risk of tenosynovitis are poorly controlled diabetics because of poor tissue healing, and also gout and rheumatoid arthritis. So if you have a persistent tenosynovitis and you can't think of an obvious overuse cause, then do get medically checked out. A simple blood test is usually all that's needed to check for these conditions. Well, pain directly over the affected tendon is the most common symptom. It's usually a dull ache, but with intermittent sharp stabs of pain when moving the wrist. The tendon might also be swollen, and because any swelling is contained within the tendon sheath, it tends to be very localized, rather than spreading out around the whole wrist like a joint swelling might do. And when tendon sheath swelling has been there for a while, it tends to get a bit sticky and it can cause a creaking or a popping sensation when the tendon moves. We call this tendon crepitus, and it's another common sign of chronic tenosynovitis. The other common symptom is local tenderness. So if you poke around the affected tendon with a finger, it's usually going to be painful. And because it's an overuse problem, any movement of the affected tendon is also likely to be painful. So that might be a wrist movement or a movement of the finger or thumb. And if these symptoms persist, then you're likely to get weakness and stiffness of the wrist and the fingers or thumb. Well, thankfully, this is usually fairly straightforward because the wrist tendons are quite easy to feel and they tend to get very tender when inflamed. So basically, a patient with a wrist tenosynovitis is usually going to point to the exact tendon which is affected. So you can divide the wrist up into 6 sections. On the back of the wrist, the patient might point to the thumb side of the wrist, the middle area, or the little finger side. And similarly, on the palm side of the wrist, they might also point to the thumb side, the middle part of the wrist, or the little finger side. And each of these 6 areas corresponds to a particular tendon or group of tendons. Now buckle up, because in the next section I'm going to go through these tendons and they all have long Latin names. But don't let that put you off. Being able to name the particular tendon affected is nice to know, but it's not really necessary. Just knowing which of these 6 areas is your problem area is enough to follow the treatment regime. So if your pain is over the back of the wrist on the thumb side, right here, then the tendons usually involved are abductor pollicis longus and extensor pollicis brevis. And indeed these are by far the most common tendons affected by tenosynovitis of the wrist. So much so that it gets its own name, de Quervain's tenosynovitis, otherwise known as mommy thumb, because mothers of babies and young toddlers are the most common group of people affected by this. Now, because de Quervain's is the most common wrist tenosynovitis, I've dealt with it separately in another video which I'll link to up here or in the description below. So if you think you might have de Quervain's, then go and check that video out. For the rest of you, stick around and we'll go through the other tendons that can be affected around the wrist. So let's move into the middle section on the back of the wrist. And the tendons which live here are extensor carpi radialis longus and brevis, both of which extend the wrist. Extensor pollicis longus, which straightens the thumb. Extensor indicis, which straightens the index finger. Extensor digitorum, which extends the wrist and straightens all of the fingers. And extensor digiti minimi, which straightens the little finger. Still on the back of the wrist, but now over the little finger side, we have extensor carpi ulnaris, which is a large tendon that extends and also side bends the wrist like this. ECU is the second most common wrist tendon affected by tenosynovitis. Now onto the palm side of the wrist, and over the little finger side we have flexor carpi ulnaris, which helps flex the wrist, and this is the third most common wrist tendon affected by tenosynovitis. In the central portion of the palm we have the 8 flexor digitorum tendons which bend the fingers, and flexor pollicis longus tendon which bends the thumb. And then finally over the thumb side we have flexor carpi radialis, which is another wrist flexor. This diagram can be really useful in helping to determine which tendon it might be. So to work out which tendon might be affected, you first have to look at which of the 6 sections of the wrist is most painful. And then, if there are a few different tendons within that section, you would then look at the movement which is most painful, either a wrist movement or a finger or thumb movement, and then see which tendon is responsible for that movement. Of course, you could then go and see a hand specialist and they could image the wrist for you using MRI or preferably ultrasound, which can show the wrist tendons beautifully and see them moving in real time. In tenosynovitis, on an ultrasound scan, the tendon will be surrounded by a halo of fluid. This sometimes gets called a bullseye sign because you can get a white central tendon surrounded by a black ring of fluid, resembling a bullseye. Before we get started on the treatments, let me just say that a single first episode of tenosynovitis will almost always get better with the following treatments. But if you don't address the reason why it occurred in the first place, then it's highly likely to come back. So make sure to stick around until the end of the video, because I'm going to talk about the things you can do to mitigate against this becoming a repetitive problem in the future. Okay, so on to the treatments. And once you've identified which tendon, or at least which of the 6 areas of the wrist is the one most likely affected in your case, you must now rest it, or at least reduce whatever activity you've been doing that has aggravated it. This is paramount, or you're going to be fighting an uphill battle. So it might be reducing your gaming time, your mouse use, a particular sport, or whatever it is in your case. Some form of immobilization splint can also be really helpful. A general wrist splint like this one can be a godsend in most cases of tenosynovitis. Just make sure that you use it pretty much all of the time to start with, and then slowly wean off as the symptoms settle. You can even wear it at night if your pain is severe and disturbing sleep. The other thing you can do to help yourself is some form of anti-inflammatory treatment. If you can take oral anti-inflammatory tablets, then that's usually the most effective option. Just make sure that you check with a prescriber or a pharmacist first, as not everyone can take them. If you can't take the tablets, then you might be able to use the gel, which can also be very effective, as these tendons are very superficial and the gel can usually penetrate to an effective depth. Just make sure you use the tablets or gel as instructed on the packet. They won't work if you use them sporadically. They must be used regularly and at maximum dose, and usually for a few weeks. If you can't use anti-inflammatory tablets or gel, then you could use an ice pack, applied for about 20 minutes, 3 or 4 times daily. Now in most cases, if you follow this advice, then your tenosynovitis should settle down, usually within about 6 weeks. If yours doesn't, then just ask yourself if you've given your wrist enough rest, as continued overuse is the main reason why most tenosynovitis doesn't get better. But if you feel that you've done everything you can and it's still painful and maybe swollen, then go and get professional advice. A simple blood test can check for diabetes, gout, or rheumatoid arthritis. Like I mentioned earlier, if you have one of these conditions, then it's important to treat that first, as your tenosynovitis might not improve until you do so. But if these conditions have been excluded and your tenosynovitis is not responding to the usual self-help treatments, then the next step would usually be a cortisone injection. These can be done in general practice by basically injecting the painful tendon by feel, but my preference is to inject under ultrasound guidance, as the needle can be precisely placed into the swollen tendon sheath and therefore the drug is delivered exactly where it is needed. A tendon sheath injection is usually a curative treatment in the majority of cases. Sometimes it might need repeating a second time, but once is usually enough. And finally, for those rare cases of persistent tenosynovitis that have been resistant to all the treatments we've talked about so far, then surgery is the last resort option. De Quervain's tenosynovitis is the one exception where surgery is a fairly common treatment, but for the other wrist tendons, surgery is much less common, and indeed I can count the number of patients I've sent to a surgeon on one hand, as it's rarely needed. The surgery involves removing inflamed tissue and scar tissue in a procedure called a debridement, and then sometimes rerouting the tendon into another part of the wrist. Okay, so this might be a single episode of tenosynovitis that you've had due to a one-off period of time when you were overloading your wrist, and now that you're all better, you might not expect it to ever come back again. And that's great. But as I mentioned earlier, in some people, tenosynovitis can become a problem which recurs time after time if you continue to do the activity which is annoying the wrist tendons. So this next section is aimed at the person who is overloading their wrist frequently. Maybe it's due to their job or a sport that they love to do, but they just can't stop doing the problem activity for the long term. And so if that person is you, then you basically have two choices if you want to stop this from becoming a recurrent problem. You can either reduce or modify the activity which is causing the problem, or you can increase your wrist strength so it can cope with that activity. And that's it. Two choices. So option 1, the reduced activity option. Now this might mean just simply reducing the offending wrist activity for the long term. That might be easy to do if it's a pastime like gaming or a sport, but it's a harder option when the activity might be related to your job. So the first thing to do is discuss it with your employer and see if you can get an ergonomic assessment, because there might be a solution to help reduce the strain on your wrists, as the chances are that other people will have also had this problem and found a solution. It might involve using a certain tool or a piece of equipment to help make a repetitive job a bit easier. If you work in an office, then the usual culprits are the mouse and keyboard, especially the mouse. A conventional mouse like this one can easily overload the wrist extensor tendons over the back of the wrist. So changing to an ergonomic mouse like this one might be a really simple solution. This type of mouse puts your wrist in a much better ergonomic position and can make a huge difference in reducing wrist extensor tendon pain. I'll put a link to this particular mouse in the description below because it's one that I can personally recommend. Ergonomic keyboards like this one can also set your wrists in a much better position and can help offload those wrist extensor tendons. And there are many different products on the market aimed at making certain jobs easier and with less strain on the joints. So do a bit of research if your wrist pain is being caused by your job. If it's a sport, then the best option is usually to talk to a professional coach. Changing your technique, using a different bit of kit, or starting a specific training regime might be the solution. Now the other option, option 2, is to try and increase your wrist strength and resilience so that it can hopefully cope with the activity that you're asking it to do. So this option might be suitable for the person who just can't reduce their wrist activities for the long term. They might be worried about losing their job or having to stop a particular sport permanently. In this case, strengthening the wrist might be their only option. Before starting an exercise program though, you're going to need to settle the pain down as much as possible by doing the treatments that we've already talked about earlier in the video. If you start trying to strengthen the wrist while the tenosynovitis is still active, then you're just going to make it worse. There are no shortcuts with this. You can only start the exercises once it's settled right down. Now, I've done a separate video which goes through a detailed program of stretches and strengthening exercises for the wrist, and I'll link to that up here and also in the description below. Just make sure that you take your time, start really gently and progress really slowly, as the last thing you want to do is cause another episode of your tenosynovitis because you've overcooked the exercises. You must respect pain and be prepared to back off if needed. Give yourself at least 3 months to go through a wrist strengthening program. Okay, well that about wraps up tenosynovitis of the wrist. I hope the video has been helpful for you. If not, and you think your wrist pain is due to something else, then I've got quite a collection of videos on the channel now covering all of the common and many of the uncommon wrist conditions, so do go and check out the history. Chances are that I've covered it. Well, that's it. Thanks very much for watching. Take care and bye for now.